Today's topic, burnout and how to prevent it so you are not a casualty of this common malady in nursing today. Did you know that nurses have one of the highest rates of burnout among all healthcare professionals? And based on my experience, I am sure that nursing students and nurse educators are not far behind. No one is immune to the consequences of persistent and sustained stress over time, which is the lived reality if you are a student or nurse educator. Though stress is part of life, there's only so much fight or flight that a person can handle before they begin to become overwhelmed, unable to cope. And this stress response over time will eventually lead to burnout. But the disastrous consequences of burnout can be avoided if it is recognized early. But we're going to talk about burnout step by step, kind of a slow fade. The literature says there's 5 stages to what burnout looks like. And let's look at this and reflect and determine if you are experiencing, whether you're a student or a nurse educator, you're not immune to the stages of burnout. Stage 1, you are mentally and physically exhausted. You're always tired despite getting adequate rest. You're also empty emotionally and depressed, and you have little or no desire to relate or engage with patients, students, or others. That's step 1. From my experience as an educator, many students and even educators are in this stage already, even in that first year. Stage 2, this is where it progresses. Indifference to the suffering of others, especially patients that you as a student are caring for. You make cynical and uncaring remarks and have an uncaring attitude. You dehumanize the patient with gossip, slander, or derogatory slang. Stage 3, you begin to feel like a failure. You begin to question, why did I ever want to become a nurse or even a nurse educator? Feelings of being helplessness, that nothing that I do will change my current lived reality. This will progress to stage 4, that now you personalize the failure and you say, I am a failure as a person. This is a subtle but dangerous slide, because instead of feeling like a failure, you say, I am a failure. And that's not okay. We're sliding precipitously to stage 5, which is complete burnout. You're just going through the motions. You perform responsibilities or what is expected with no involvement, commitment, or enthusiasm. I see nurses in practice and even nurse educators in stage 5. You're completely disengaged from the program and others, and you contemplate quitting and throwing in the towel, saying, I am done with this. But the fire can be put out of burnout. And I want to share some simple strategies to begin to neutralize the power of burnout if it's beginning to manifest in your life. As a student or nurse educator or even a nurse in practice, we're also not immune. Number 1, cultivate connection to others, especially student colleagues, not social media and Facebook. I think you know this, but Facebook friends, even having hundreds of them, they're not your real friends. They're just a mirage. And when you need them most, they will not be there for you. Secondly, don't neglect those things that are really most important. Your faith, family, friends. Simply because they don't demand your immediate attention doesn't mean they're not important. And third, nurture your spirituality. If you have a belief and faith in God, now is the time to draw upon this needed source of strength and get through this difficult time. You can't do it alone. My story. As a nurse in practice, I've experienced the devastating consequences of burnout. When I first began in the ED, I loved the dynamics of this stimulating and invigorating environment. I was an adrenaline junkie, and I loved every minute of it. I began to work extra hours, overtime, because it was available and more was better. Right? Wrong. But over the next year, I began to become more tired, exhausted. And what I once enjoyed over time became a burden. And I began to just put in my time and began to focus more on how much I was making with that overtime, not on my patients. When a small child who had died from sudden infant death syndrome was brought in to the emergency room, and I was the stabilization nurse, and that child eventually died, I was totally indifferent to the grief and the loss of this mother and this family. And I was disconnected and disengaged. At that moment, I realized part of my soul and my heart had died, and I needed to get it back. Burnout defined is really the progressive loss of that initial idealism, passion, energy, and purpose that you initially started with. What about you as a student? You had that initial passion, say, I'm pursuing my passion to be a professional nurse. But for some of you, it is on fumes, or that has died a long time ago. And that's not okay. Burnout in nursing can be defined as the loss of human caring, or stated another way, the loss and the separation of caregiving and caring. But in closing, there is the rest of the story. My story on burnout, when I realized that I was beginning to lose my heart and soul as a caregiver, I knew I had to do things differently and drastically. So I made the difficult decision to leave the emergency department and pursue a different position at another hospital in the critical care float pool where I knew I could be restored. It has been 10 years since I left the emergency department, and by changing scenery in this critical care float pool at another hospital, I continue to be engaged and still enjoy clinical practice after 33 years. So I want to encourage you to make it a priority. If you see that you're beginning to fade, basically don't let it slide. But remember this, it's far better to prevent the fire from being totally burning out than trying to put it out after it's begun. So put out the fire now and do what's needed. And you will be a nurse who will go the distance in your career. And that's what I want for you. Thank you.